to speak about the restrictive lung diseases. So it may lead to decreased lung volumes because of this restriction. There is what? There is decrease in forced vital capacity. What is vital capacity? An inspiratory reserve volume plus tidal volume plus expiratory reserve volume. So all these volumes will decrease the forced vital capacity because there is restriction of expansion of the lung. Of course, there is also decreased total lung capacity. Why? Because total lung capacity equals vital capacity plus the residual volume. Residual volume will decrease and vital capacity will decrease, leading to decrease the total lung capacity. Then pulmonary function test. It's normal or increase the ratio between forced expiratory volume 1 and forced vital capacity. Why? Because the decrease in forced expiratory volume 1 less than the decrease in forced vital capacity in restrictive disease, leading to increase the ratio, or it will be normal. So in obstructive disease there is decrease the ratio because there is air trapping and there is much decrease in forced expiratory volume 1. But here in restrictive disease the decrease in forced expiratory volume 1 less than the decrease in forced vital capacity, leading to increase the ratio. So the ratio normal or increase in restrictive lung disease, but it will decrease in cases of obstructive. So here there is increase in the ratio. Then the patient presents with short shallow breath. Then the types it may be from outside or affection of alveoli. So if it's from outside there is no effect on alveoli, but if it's from inside, so there is effect on alveoli. So here from outside means what? Extrapulmonary. So alternation in respiratory mechanics. So of course there is normal DELCO. What is DELCO? Diffusion limited carbon monoxide, because there is normal alveolar wall. The effect extrapulmonary. There is no effect on alveoli. There is no destruction of the alveolar wall. So the diffusion of carbon monoxide is normal. Plus there is normal AA gradient. What is A? A capital alveoli, A small arterial. So there is normal gradient between them because there is normal gas diffusion. It's from outside. It's extrapulmonary. So extrapulmonary like what? Respiratory muscle weakness, polio. So you take polio vaccine. Myasthenia gravis means what? Antibodies against acetylcholine receptor in post synapse. Competition on the receptor, on acetylcholine receptor, leading to weakness of the respiratory muscles. Then Guillain-Barré syndrome. What's meant by it? There is GIT infection or respiratory infection. Then after it there is neurological disorder, paralysis. So paralysis following GIT infection or respiratory infection. So it's called what? Guillain-Barré syndrome. Then ALS, amyotrophic lateral sclerosis. It's called what? It's called motor disease because it's affecting the upper motor neuron and lower motor neuron. Then the next one, chest wall abnormalities like scoliosis, bending of the vertebrae. Then severe obesity. There is compression from the outside of the lung because of this obesity, leading to decreased expansion of the lung. So it's restrictive lung disease. Then the next one, from inside, effect on the alveoli. So diffuse parenchymal lung disease. It's inside the lung. So it's called interstitial lung disease. It's pulmonary, from inside. Of course, if there is effect on alveoli, there is decrease in the diffusion of carbon monoxide. So there is decrease in the diffusion limited carbon monoxide, and there is increase in AA gradient. The difference between alveoli and arterial gradient, this gradient will increase. Because there is the destruction of the alveoli. So there is increase in gradient between alveoli and arterial blood, and there is decrease in diffusion of carbon monoxide. So these are the diseases that can cause the restrictive lung disease, like what? Pneumoconiosis. pneumoconiosis, it's called coal worker pneumoconiosis, silicosis, asbestosis. Then the next one, this is so important, sarcoidosis, it's bilateral hilar lymphadenopathy, non-caseating granuloma, increase in ACE, increase in the calcium, plus what? Plus African American plus what? Plus increase CD4 CD8 ratio, increase CD4 CD8 ratio, plus what? Uveitis. So we have here in sarcoidosis non-caseating granuloma, this is the most important, plus African American increase CD4 CD8 ratio. Then there is increase in ACE, increase in the calcium, and bilateral hilar lymphadenopathy, non-caseating granuloma, increase in ACE and calcium, African American, and increase in CD4 CD8 ratio, and plus uveitis. There is what also causing of restrictive lung disease, idiopathic pulmonary fibrosis, granulomatosis with polyangiitis, then pulmonary Langerhans cell histiocytosis, it's called what? Eosinophilic granuloma. Then the next one, hypersensitivity pneumonitis, so important, we will speak about it. Then this is the most important here, drug toxicity. We have bleomycin busulfan, bleomycin BB, busulfan BB, so pulmonary fibrosis, plus amiodarone methotrexate, which will cause fibrosis of the lung. This is the most important. We have these drugs causing restrictive lung disease, bleomycin busulfan, and amiodarone methotrexate, bleomycin busulfan and amiodarone methotrexate. All of these drugs will cause restrictive lung disease. Then acute respiratory distress syndrome, this means what? Release of cytokines that will destruct the alveolar wall, leading to expansion of protein into the alveoli, leading to decrease gas exchange. So in cases of what? In cases of sepsis and pancreatitis and sepsis, acute respiratory distress syndrome, cytokines that will destruct the alveolar wall, leading to expansion of protein into the alveolar wall, leading to decrease gas exchange. So it will occur in sepsis, pancreatitis. Then there is radiation-induced lung injury, from its name, radiation that will cause lung injury. So it's associated with releasing of pro-inflammatory cytokines like tumor necrosis factor alpha, interleukin 1, interleukin 6. So it may be asymptomatic, and most common symptoms are dry cough, plus dyspnea, plus or minus low-grade fever. So it can come into two forms. The first one, acute radiation pneumonitis. The second one, radiation fibrosis. So the first one, acute radiation pneumonitis, develops within 3 to 12 weeks. It's called the exudative phase. The second one, called the radiation fibrosis. Radiation will cause fibrosis, may develop after 6 to 12 months. So it can come into two forms. The first one, acute radiation pneumonitis, develops 3 to 12 weeks, exudative phase. The second one, radiation fibrosis, may develop after 6 to 12 months. Then the next one, so important, called idiopathic pulmonary fibrosis. Why it's idiopathic? Because of unknown cause. So progressive fibrotic lung disease of unknown cause. It may be associated with what? Cigarette smoking, environmental pollutants, and genetic defects. So again, it may be associated with what? Cigarette smoking, environmental pollutants, and also genetic defects, leading to what? Release of there is the inflammation and fibrosis of the lung of unknown cause. But this, if you know the cause by removing it, so you can decrease the risk factor like cigarette smoking, environmental pollutants, plus genetic defects. So progressive fibrotic lung disease of unknown origin, unknown etiology may involve multiple cycles of lung injury. Then the finding, the most important one, honeycomb appearance. So you have progressive dyspnea, fatigue, non-productive cough, crackles, clubbing, and on imaging you will find honeycomb appearance. So you have peripheral reticular obesities, traction, bronchiectasis. So fibrosis leading to traction bronchiectasis plus peripheral reticular obesities. The most important one, honeycomb appearance of the lung, advanced disease. So honeycomb appearance. The histologic pattern, it's usual interstitial pneumonia. Then the complication is what? This is so important. Why? Idiopathic pulmonary fibrosis. If there is fibrosis leading to what? Pulmonary hypertension. And pulmonary hypertension will cause what? Will cause right heart failure. Then there is distension of the right side of the heart. This distension leading to impairment of electricity on the right side of the heart, leading to what? Arrhythmia. And of course there is association with what? With coronary artery disease, with respiratory failure because of fibrosis and lung cancer. But the most important one, causing pulmonary hypertension, which will cause the right-sided heart failure and arrhythmia. Then the next one, so important, hypersensitivity pneumonitis. Now why it's so important? Because of this sentence, irreversible fibrosis, non-caseating granuloma, alveolar septal thickening, and traction bronchiectasis. So it's asked in the exam, irreversible fibrosis, non-caseating granuloma, thickening of the alveolar septa, and traction bronchiectasis. So you must memorize this sentence. In case of what? Hypersensitivity pneumonitis. So the most important one, non-caseating granuloma with this fibrosis plus thickening of the alveolar septa. So it's asked in the exam, irreversible fibrosis, non-caseating granuloma, alveolar septal thickening, and traction bronchiectasis will cause hypersensitivity pneumonitis. So it's mixed type 3 and type 4 due to environmental antigen. So it's seen in what? In farmers and bird fencers. So type 3, type 4 hypersensitivity due to environmental antigen. So it's self-limiting because of what? If the stimulus is removed. The stimulus is what? The environmental antigen in farmers, bird fencers, and it can cause what? Acutely causes dyspnea, cough, chest tightness, fever, headache, any manifestations of the lung. But the most important is the chronic manner. It's asked in the exam, irreversible fibrosis, non-caseating granuloma, alveolar septal thickening, plus traction bronchiectasis. This will indicate that the case is what? Hypersensitivity pneumonitis.